Early signs that cancer is growing in your body. Could your body be signaling something important that you've overlooked? Recognizing subtle indicators of cancer can be challenging, as these early signs are often vague and misunderstood. Despite affecting millions globally, many symptoms go unnoticed or are misinterpreted. Understanding these signs isn't just about awareness, it's about acting early, which can significantly improve outcomes. But what exactly are these early signs, and why do they vary from person to person? In a world flooded with information, separating fact from noise can be difficult. Our goal is to provide you with clear, evidence-based insights into these early warning signs. Join us as we break down the key signals your body might be sending and when it's time to consult a doctor. 1. Persistent fatigue. Persistent fatigue is often one of the earliest signs that cancer may be developing in your body. If your energy levels have drastically dropped and no amount of sleep or rest seems to restore them, it's worth taking seriously. This isn't the typical tiredness that follows a busy day, it's a deep, relentless exhaustion. Such fatigue is particularly associated with cancers like leukemia or lymphoma, which impact the blood and bone marrow, impairing your body's ability to produce healthy blood cells. As a result, you may feel perpetually drained, regardless of your efforts to recover. Muscle weakness or confusion might also accompany this fatigue, especially with cancers that disrupt hormone levels or cause internal bleeding, such as colon or stomach cancer. When cancer interferes with your body's normal processes, it can leave you in a constant state of exhaustion and trigger other related symptoms. Persistent fatigue is easy to dismiss as stress or overwork, but if it continues without explanation, it's vital to consult a doctor. Medical tests can uncover any underlying issues that require attention. Listening to your body's signals is crucial. While fatigue might seem insignificant, when it's prolonged and unexplained, it could indicate something more serious. Don't ignore it. Seek medical advice to ensure your health and well-being. 2. Persistent headache. A headache that doesn't subside, even with over-the-counter or prescribed medications, can be concerning. If you're experiencing a persistent headache that lasts more than 2 weeks, it's crucial to consult a doctor. Such a headache could be an early warning sign of a more serious issue, such as a brain tumor or other brain cancers. In addition to the headache itself, other neurological symptoms might accompany it, including blurred or double vision, changes in hearing, or facial drooping. If these symptoms occur alongside a persistent headache, prompt medical evaluation is essential. Seizures or other unusual neurological events should also be assessed immediately, as they could indicate changes in brain function that require urgent attention. Brain tumors can press on nerves and interfere with normal brain processes, leading to persistent headaches and other neurological symptoms. Ignoring these warning signs can be dangerous. While most headaches are not related to cancer, those that fail to respond to typical treatments and persist for an extended period warrant thorough investigation. Early detection can significantly improve the treatment and management of brain tumors and other related conditions. Paying attention to your body and acting when something feels off is critical. If your headache persists and is accompanied by neurological symptoms, don't delay seeking medical help. Being cautious and proactive ensures you receive the care you need. 3. Changes in urinary or bowel habits. Changes in your urinary or bowel habits can be an early indication that something is amiss in your body. If you experience persistent constipation or diarrhea lasting several weeks, it's important to consult a doctor. While these symptoms may seem minor, they could point to serious underlying conditions, including cancer. Altered bowel habits may stem from inflammatory bowel diseases like Crohn's disease, but can also signal colon or stomach cancer. These cancers disrupt the digestive system, causing noticeable changes in the frequency, ease, or comfort of bowel movements. Similarly, urinary changes such as pain during urination, increased frequency, or a weak urine stream may indicate urinary tract issues, an enlarged prostate, or, more seriously, prostate or bladder cancer. If you notice these changes, seeking medical evaluation is essential. While such symptoms can often be attributed to less severe conditions, they may also serve as early warning signs of cancer. It's always better to investigate and rule out serious health concerns than to ignore symptoms and risk the progression of a potentially treatable condition. Being proactive about your health means listening to your body's signals. If you experience any persistent changes in urinary or bowel habits, don't hesitate to consult a healthcare provider. Early detection and treatment can dramatically improve outcomes for conditions like colon, stomach, prostate, and bladder cancers. 4. New or unexplained pain. Pain without an obvious cause, such as an injury or illness that doesn't respond to standard treatments, should be taken seriously and evaluated by a doctor. Pain is your body's way of signaling that something might be wrong. If you're experiencing persistent, unexplained pain, it could be a warning sign of cancer. For instance, abdominal pain in men could point to prostate, bladder, testicular, or penile cancer. In women, unusual pain or tenderness in the breasts might indicate breast cancer. This type of pain is not typical and doesn't improve with usual remedies, suggesting that a more serious issue could be at play. Pain can also be a symptom of internal cancers. Persistent heaviness or swelling in the scrotum, for example, may signal testicular cancer, while ongoing abdominal discomfort could suggest conditions like liver or pancreatic cancer. These types of pain are often overlooked or dismissed as minor issues, but they should not be ignored. Dismissing unexplained pain can be dangerous. While it's easy to attribute persistent discomfort to less severe causes, if the pain lingers and cannot be linked to a known explanation, it's critical to seek medical evaluation. Early investigation could uncover serious conditions and improve treatment outcomes. 5. Mouth sores that won't heal. Mouth sores that don't heal within a couple of weeks should never be ignored. Persistent sores, lesions, or white patches on your lips, tongue, gums, or other areas of your mouth may be a sign of oral cancer. This type of cancer can develop in various parts of the mouth, including the lips, tongue, and throat. Those who use tobacco or consume alcohol heavily are at an increased risk for oral cancer. Mouth sores are especially concerning if accompanied by other symptoms such as difficulty swallowing or unexplained weight loss. Additionally, white patches in the mouth, known as leukoplakia, can serve as a warning sign. Leukoplakia is a precancerous condition that, if untreated, may progress into cancer. Although these patches might seem harmless, they require evaluation by a healthcare professional to determine the best course of action. Ignoring mouth sores can have serious consequences. Oral cancer can be aggressive, and early detection is critical for successful treatment. If you have sores that don't heal, seek medical advice without delay to ensure timely care and intervention. 6. Blood in the urine or stool. Seeing blood in your urine or stool is alarming and should never be ignored. Blood in the stool may appear black and tarry or bright red, while blood in the urine can range from pink to red or dark brown. These symptoms could indicate serious conditions, including cancer. Blood in the stool is often associated with digestive system cancers, such as colon or rectal cancer. It can also result from conditions like inflammatory bowel disease or ulcerative colitis, which disrupt the normal functioning of the digestive tract and may lead to bleeding. Similarly, blood in the urine may be a sign of prostate or bladder cancer, though it can also indicate infections or other urinary tract issues. The presence of blood is a clear signal that something is wrong and needs to be evaluated by a healthcare professional. If you notice blood in your urine or stool, don't delay seeking medical advice. Prompt evaluation is essential to identify the underlying cause and begin appropriate treatment. Your health is too important to overlook these potential warning signs. 7. A cough or hoarseness that won't go away. A persistent cough or hoarseness lasting longer than 2 weeks should be evaluated by a doctor. A dry, hacking cough that doesn't improve could be a sign of lung cancer, especially if it's accompanied by coughing up blood or bloody discharge symptoms that require immediate medical attention. Similarly, hoarseness or a raspy, strained voice that doesn't resolve can also be a warning sign. Changes in your voice, particularly when paired with difficulty swallowing or pain in the neck or throat, may indicate thyroid or throat cancers. Persistent coughing and hoarseness are often dismissed as minor issues, but when these symptoms linger, they can signal more serious conditions. Chronic coughing, for example, is a common symptom of lung cancer that doesn't respond to typical treatments. It's crucial to listen to your body and not ignore ongoing respiratory symptoms. If you experience a cough or hoarseness that persists for more than 2 weeks, consult a healthcare provider promptly to determine the underlying cause and begin appropriate treatment. Early detection can make a significant difference in outcomes. 8. Excessive bruising. Excessive bruising, especially in unusual places on your body, can be a warning sign of certain blood cancers. If bruises appear without a clear cause, it's important to consult a doctor. This type of bruising may indicate issues with your blood cells, such as leukemia. Leukemia interferes with the production of healthy blood cells, leading to symptoms like frequent or unexplained bruising. These bruises may appear on areas like your arms, legs, or other spots where you wouldn't typically expect them. This symptom should not be overlooked, as it can be an early indicator of a serious condition. Alongside bruising, you might also experience other symptoms, such as frequent nosebleeds or bleeding gums, which can further point to blood disorders or cancers. Pay close attention to changes in your body, including unexplained bruising. If you notice bruises appearing frequently in unusual locations, don't delay seeking medical advice. Cancer can manifest in subtle ways, and recognizing these early signs is crucial for timely detection and treatment. Always prioritize your health and consult a healthcare provider if you experience any of these symptoms. Thank you for watching this video. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information. Also, watch the video on your screen. We think you will find it just as informative and engaging. Thank you again for watching, and see you in the next